I'm going to discuss the next approach of the immune therapy, especially by using monoclonal antibodies against the tumor. And these anti-tumor monoclonal antibodies are also called as biotherapeutics. These are very expensive and they have been developed recently within these 20 years or so, and different types of monoclonal antibodies have been developed to treat different types of cancers. And these biotherapeutics have different mechanism of action. The mechanism of action of these monoclonal antibodies can be classified as follows. One mechanism of action of monoclonal antibody will be antibody dependent cell mediated cytotoxicity, ADCC response, and these monoclonal antibodies bring about cytotoxicity against the tumor cells by ADCC approach. The second approach will be the monoclonal antibodies initiate complement mediated lysis, that is CDC response. Then the third type of monoclonal antibodies alter the cell signals or inhibit the cell signals in the tumor cells and inhibit the tumor cell growth, and those monoclonal antibodies are called as altered signal transduction antibodies. Then the delivery of cytotoxic payload, that is, the monoclonal antibodies are designed in such a way that they carry the toxins or radionuclides or the chemotherapeutic drugs attached to them and directly deliver to the tumor cell on the site of the tumor by killing the tumor specifically and avoiding systemic toxicity. So this is how monoclonal antibodies have been designed and engineered and developed. Now coming to engineered monoclonal antibodies. Here is one of the method that shows the modified monoclonal antibodies. First, on the extreme left hand side is the normal monoclonal antibody or the antibody structure. The antibody has an FAB site, then three constant region domains, that is CH1, CH2 and CH3, and one constant region domain of the light chain. Now these monoclonal antibodies have normal molecular weight of 150 kilodalton and the half-life of 330 minutes. Such monoclonal antibodies can be modified into the smaller fragments by having exclusively only the variable region fragment. Now here, this monoclonal antibody, which has been designed having only the variable region fragment, and it has a molecular weight of only 29 kilodaltons and the half-life of only 10 minutes. See, the original monoclonal antibody, it has a half-life of 330 minutes, but only the fragment of variable region has half-life of 10 minutes. One can have a monoclonal antibody like this, especially engineered, and the FAB fragments can be linked together by a special protein chain. Similarly, one can have two fragment of variable regions linked together by a protein chain, and each of those fragments of variable region are held by their peptides, separate peptides. With a modified molecular weight, it is 55 kilodaltons and longer half-life of 173 minutes. And another called as mini antibody or mini body. It has got only one constant region domain, that is CH3 domain. Other two domains have been removed, plus the constant region domain of the light chain has been removed, and only the fragment of variable region is retained. Such a mini body has a molecular weight of 80 kilodaltons and have a half-life of about 288 minutes. Another monoclonal antibody is the one having a streptavidin, and streptavidin molecule is linked in the middle of the four different FAB sites, and those four different FAB sites are linked to the streptavidin through a peptide chain, and each of the FAB sites or fragment of variable region sites are linked together by a peptide molecule. And this has a molecular weight of 174 kilodaltons and has a half-life of 546 minutes. Because it has been linked with the streptavidin, this antibody molecule can be made to bind to a particular tumor cell using a specific antigen which is specific for the fragment of variable region, that is FAB site, and after binding there, the biotinylated radionuclide or biotinylated toxic chemotherapeutic drug can be introduced, which goes and binds to the streptavidin because streptavidin and biotin have a strong affinity. Here, once again, some other modified molecules are shown at the bottom side, which is called as a triabody. Triabody having three different FAB sites or fragment of variable regions, and tetrabody or four fragment of variable regions linked together by peptide chains, and each of them specific for different antigens on the tumor cells. Each of them having different molecular weight, different half-life, have been engineered specifically to treat the tumor cells by targeting them against the tumor antigens expressed specifically by the tumor cells. Therefore, overall toxicity of the chemotherapeutic drugs or radionuclides can be avoided. Now, let us see the different types of the therapies that are carried out with the monoclonal antibodies. The monoclonal antibodies are designed against certain receptors of the tumor cells. For example, in the case of B-cell lymphoma, CD19, CD22 and CD30 are overexpressed. And by treating the B-cell lymphoma with a simple monoclonal antibody of this type, which is shown here without any modification, the monoclonal antibody is just like the normal antibody having all the domains in it, and this monoclonal antibody in fact is capable of initiating complement mediated lysis as well as ADCC response because it has intact FC receptor FC site. So this monoclonal antibody, when it is injected, which is specifically meant for CD19 or CD22 or CD30 of the B-cell lymphoma, can bring about B-cell lymphoma lysis by introducing these antibodies by the action of ADCC response or complement mediated lysis, thereby decreasing the population of B-cell lymphoma cells. Similarly, T-cell leukemia cells which overexpress IL-2 P-alpha receptor, and this monoclonal antibody is designed specifically to react on IL-2 P-alpha receptor of the T-cell leukemias, will initiate the killing of the leukemia T cells by initiating ADCC or complement mediated lysis. There are other monoclonal antibodies designed to act on certain immune cells and certain tumor cells. For example, rituximab. Please note some of the trade names of the monoclonal antibodies end with MAB. MAB stands for monoclonal antibody. The Rituxan is the trade name for the rituximab antibody, which is designed against CD20 receptor of the B cells. And these B lymphocytes, which overexpress CD20 receptors in B cell lymphomas, are targeted specifically by using this monoclonal antibody which is conjugated with chemotherapeutic drug. The chemotherapeutic drug is bound to the monoclonal antibody to the peptide chain which is linked to the FAB region or fragment of variable region. As in these engineered monoclonal antibodies, you will see there is a peptide chain which is overhanging, and The chemotherapeutic drug linked to this monoclonal antibody specifically delivers the chemotherapeutic drug to the tumor cells only, thereby avoiding the systemic toxicity of the chemotherapeutic drug. So, rituximab or rituxan directed against CD20 of the B cell lymphoma linked to the chemotherapeutic drug successfully kills B cell lymphoma cells. Then altered cell signals. You know that in tumor cells there is overexpression of epidermal growth factor receptor. The expression of epidermal growth factor receptor facilitates tumor growth. And by blocking this receptor, that is EGFR, epidermal growth factor receptor, one can bring about control in the growth of the tumor cells. There are two types of monoclonal antibodies developed against the EGF receptor, EGFR. And these two EGFR specific monoclonal antibodies are cetuximab, the trade name of that is Erbitux, or panitumumab, panitumumab, which are known to bind to these receptors, that is EGFR, and bring about blockade and prevent the functioning of the receptor, normal functioning of the receptor. Hence, the tumor growth can be suppressed. The overexpression of the EGFR receptor has been observed in small cell lung cancer, breast cancer, colorectal cancer, prostate cancer, and head and neck cancer. And if one conjugates the cetuximab and panitumumab, these monoclonal antibodies, with a chemotherapeutic drug like cisplatin or doxorubicin, both are toxic drugs. Doxorubicin or cisplatin can be conjugated to cetuximab or panitumumab and delivered to the patients suffering from small cell lung cancer, breast cancer, or prostate or colorectal cancer or head and neck cancer who overexpress EGFR. By conjugating the monoclonal antibody against the anti-EGFR receptor with the chemotherapeutic drug, one can specifically kill those tumor cells in the patient and avoid systemic toxicity. Similarly, the monoclonal antibodies can be also conjugated with the toxic agents like calicimicin or statin, and I've already mentioned about doxorubicin. And the specific killing of tumor cells can be brought about by pre-targeting technology. And whichever the monoclonal antibody which is conjugated to these toxic drugs, doxorubicin, calicimicin, or statin, will help in killing of the tumor cells specifically, and normal cell killing does not take place because they deliver the drug at the tumor site onto the tumor cells, which is called as targeted therapy. Another therapy that is present called as ADEPT, ADEPT, antibody directed enzyme pro-drug therapy. The antibody dependent enzyme pro-drug therapy involves the antibody directed against the tumor antigen is conjugated with an enzyme, and that enzyme is responsible for metabolizing the drug to the toxic component. And the drug which is in the form of prodrug, which is converted to a toxic form, will happen only on the surface of the tumor, because the monoclonal antibody is directed against the tumor, and that monoclonal antibody goes and binds to the tumor surface, and it is conjugated with the enzyme, and that enzyme, on coming in contact with the drug, which is injected separately to the individual, converts the drug to a toxic component on the surface of the tumor, bringing about the death of the tumor, which is a very novel approach called as ADAPT. Then coming to the other approach where anti-tumor monoclonal antibodies are coupled with radionuclides. They are attached to the radionuclides or bacterial toxins which deliver the radionuclide or the bacterial toxins onto the surface of the tumor cell. The radionuclide nuclei conjugated monoclonal antibodies, it is called as radioimmunotherapeutics. Radionuclide conjugated monoclonal antibodies is called as radioimmunotherapeutics, and these have been successfully used for the treatment of B-cell lymphomas and non-Hodgkin's lymphomas. The two antibodies that are designed by the two different companies, especially ibritumumab tioxetan. Ibritumumab tioxetan is having yttrium-90 as a radionuclide. Tocilizumab has I-131. Tocilizumab has I-131, iodine-131. Both these monoclonal antibodies, which are carrying the radionuclide, are targeted against CD20 antigen of the B-cell lymphomas for the treatment of non-Hodgkin's lymphoma. Similarly, there are monoclonal antibodies developed against the melanoma antigens and other carcinomas which can be delivered directly to the tumor site, radionuclides to the tumor sites. As it was mentioned earlier, anti-IL-2R receptor monoclonal antibodies, which is specifically directed against T-cell lymphomas, which is also called as immunotoxin, because it can be also conjugated with a diphtheria toxin. Diphtheria toxin brings about cell lysis, cell killing. The monoclonal antibody designed especially to attack the IL-2R receptor of the T lymphocyte is conjugated with diphtheria toxin is called as immunotoxin. And when it is conjugated with the radionuclide, it is called as radioimmunotherapeutics. Yttrium-90 also can be conjugated to the monoclonal antibody that is specific for IL-2R and bring about T-cell lymphoma killing. As I had mentioned earlier, that monoclonal antibodies can also be conjugated with streptavidin, and they are injected into the person suffering from a particular type of cancer. And as you know, biotin has strong affinity to streptavidin. The biotin can be conjugated to a radionuclide, or biotin can be conjugated to any other chemotherapeutic drug and delivered to the patient. On injecting biotin conjugated radionuclide or chemotherapeutic drug, the monoclonal antibody which is linked with streptavidin, which is already bound to the tumor, will attract the biotinated radionuclide or chemotherapeutic drug to its surface. By bringing the toxic payload to the surface of the tumor cell surface, makes the tumor cell vulnerable for the killing by the toxic chemotherapeutic drug or radionuclide, and becomes highly specific reaction on the surface of the tumor cell, thereby avoiding the systemic toxicity. Anti-idiotypic monoclonal antibodies, which are also special type of monoclonal antibodies which are used for the treatment of B-cell lymphoma. They are specifically directed against membrane-bound IgM molecule. B cell receptor is a membrane-bound IgM molecule, and its FAB site is specific as far as B cell receptor is concerned and is meant for a particular antigen. So the anti-idiotypic antibodies are directed against the FAB site of the IgM molecule of the B cell receptor. So the B cell lymphomas can be treated using the anti-idiotypic antibodies which carry the toxic payload of any chemotherapeutic drug and or a radionuclide, and then that can be delivered specifically onto the B cell surface which is having B cell lymphoma, thereby bringing about killing of the B cell lymphoma. And it is also observed that B cells, especially acute myeloid leukemia, express CD33 receptors in excess. And for that, the treatment can be brought about by using a monoclonal antibody conjugated to a drug that is calicimicin. And this monoclonal antibody is called as gemtuzumab ozogamicin. Gemtuzumab ozogamicin. And this monoclonal antibody is conjugated to calicimicin directed against CD33 receptor expressed by myeloid cells in acute myeloid leukemia for the treatment of acute myeloid leukemia, specifically by targeting the drug onto the surface of the myeloid cells by targeting CD33 receptor using a monoclonal antibody gemtuzumab ozogamicin. Some of the solid tumors, especially the colorectal cancer, pancreatic cancer, and non-small cell lung cancer, express epithelial cell adhesion molecule EPCAM, epithelial cell adhesion molecule. In short form, it is called as EPCAM. Monoclonal antibodies directed against EPCAM, a trade name for that is edricolumab. Edricolumab has undergone extensive clinical trials against colorectal cancer. And this monoclonal antibody can be linked with any toxic payload, that is radionuclides or the chemotherapeutic drugs, and made to react with the EPCAM expressed especially on colorectal cancers, pancreatic or non-small cell lung cancer, and bring about the killing of those cells. Carcinoembryonic antigen is another antigen which is expressed especially by the colorectal cancer, and the single chain fragment variable monoclonal antibody, that is SCFV fragment, single chain fragment variable monoclonal antibody, directed against the carcinoembryonic antigen expressed by the colorectal cancers. Especially this SCFV fragment can be conjugated with all types of chemotherapeutic drugs or radionuclides. The colorectal cancer can be brought under control. Even adenocarcinomas can be brought under control by using monoclonal antibodies. Another way of controlling is using tumor necrosis factor receptor, the trail receptor, which is responsible for induction of apoptosis in the tumor cells. The antibodies, monoclonal antibodies, have been directed against the trail receptors, and these monoclonal antibodies have a trade name called as mapatumumab, and that brings about expression of the trail receptor and stimulation of the trail receptor. By stimulation of the trail receptor, one can bring about tumor cell necrosis by apoptosis. Generally, the trail receptor is shut off in the active tumor. By using a monoclonal antibody, the trail receptors can be triggered, and by triggering the trail receptor, one can bring about tumor necrosis factor activated cell necrosis or apoptosis of the tumor. There is another receptor called as HER2/neu, which is overexpressed in breast cancers, adenocarcinoma, ovary, prostate, lung, and gastrointestinal cancer. The antibody developed against that trade name is Herceptin, which is called as trastuzumab. This trastuzumab can be conjugated with navalbine, taxotere, platinol, Gemzar, and Taxol. All these are chemotherapeutic drugs used for treatment of cancer to prevent the growth of tumor cells. Here, the Herceptin acts as a payload carrier of these toxic materials onto the surface of the tumor, provided these tumors express the HER2/neu receptor. There are breast cancers which are HER2 minus. They don't express HER2. In such case, this monoclonal antibody cannot be used. Herceptin can be used, or trastuzumab can be used only when the breast cancer expresses HER2 plus receptor. Even ovarian cancer, when it expresses this receptor, then only this monoclonal antibody can be used, using the payload of toxic agents. You know very well that tumors have the ability to enhance the growth of blood vessels. To enhance the growth of blood vessels, they enhance the expression of VEGF, vascular endothelial growth factor. Simultaneously, they also express VEGFR, vascular endothelial growth factor receptor. Both these are very important as far as tumor is concerned. They are associated with the tumor and tumor growth. The monoclonal antibody directed against the VEGFR, that is vascular endothelial growth factor receptor, which is called as bevacizumab. Bevacizumab has a trade name called as Avastin, which targets the VEGFR receptor and blocks it. By blocking the VEGFR receptor, blood vessel growth can be blocked. Once a blood vessel growth is blocked, the growth of tumor also can be blocked, because tumors need rich supply of blood vessels, rich supply of oxygen and nutrients for the growth. By cutting off the growth of blood vessels by using a monoclonal antibody technique or monoclonal antibody approach using bevacizumab or Avastin, one can decrease the tumor growth and kill the tumor cells by depriving them of the growth of blood vessels. The preventing of the growth of blood vessels kills the tumor completely. Here is the summary of all the monoclonal antibody therapies that have been shown or explained earlier, where the monoclonal antibody can act as ADCC or CDC, that is, it can induce antibody dependent cell mediated cytotoxicity on binding to the tumor cells and kill the tumor cell, or it can induce complement mediated lysis of the tumor cells after binding to the tumor cell, and this is the whole monoclonal antibody. Similarly, a monoclonal antibody can be conjugated to streptavidin, and biotinylated radionuclide or toxic agent can be made to bind to that monoclonal antibody, because streptavidin has strong affinity to biotin, and make the toxic payload of radionuclide or the drug to be delivered to the tumor surface. Similarly, the monoclonal antibodies which can be made to deliver the radioactive nuclide to the surface of the tumors where two different FAB sites, that is bispecific monoclonal antibodies, in the sense they are capable of recognizing two different antigens on the tumor surface at the same time. Bispecific monoclonal antibodies conjugated to radionuclide can be used to kill the tumor cells. Same way, the monoclonal antibodies conjugated to the enzyme which converts the prodrug to a toxic drug on the surface of the tumor cell and bring about cell killing, that is tumor cell killing by toxic drug, which is called as adept. And the monoclonal antibodies linked with the bacterial toxins, which are called as immunotoxins, can deliver those bacterial toxins to the surface of the tumor cell and bring about cell killing. As well as the monoclonal antibodies can be linked with the cytokines, which can be delivered to the tumor surface, and those cytokines can bring about the enhanced immune cell activity, and bring about killing of the tumor cells. This is how the monoclonal antibody approach has been used for conquering the tumors or cancers. Even though the technique is or the approach is very expensive, it does give relief to the patient, and it is less painful compared to the chemotherapeutic approach as well as radiation approach. Radiation and chemotherapeutic approach has got large amount of toxicity, and repercussions are very bad as far as the patient is concerned. Patient suffering will be very high with these two, that is radionuclides and the chemotherapeutic agents. By using monoclonal antibodies, specifically directing the radionuclides only to the tumor cells, or specifically directing the chemotherapeutic drugs only to the tumor cells, one can bring about or minimize the toxicity of these two agents and give relief to the patient and prolong the life of the cancer patient. And many of the cancer patients who have been treated with monoclonal antibodies have shown remission, and they have survived for long, more than expected time, and led a healthy, happy life because of the monoclonal antibody. It's only the thing that it is very expensive. Some necessity is there for subsidizing and government help for the poor people to be treated with monoclonal antibodies. This is as far as the immunotherapeutic approach against the cancer is concerned.